I changed the topic. I'm so sorry, but it's quite maybe this the weird talk I have ever delivered to the audience. This is not the scientific one. It's a completely personal opinion, a thought on what the surgery is. And you know, surgery is from Greek. So we have many words to describe the surgeries, but they're always the same. It means the one side is hand, the other side is the work. We do something with our hands, that is surgery. In modern concept of surgery in medicine is to cure the patient or disease with my hands. That is surgery. So, but when we have some different angle of view to looking at surgery, is everybody agrees that this is part of science and philosophy. But I think the surgery is something different from other fields of medicine. For example, internal medicines or dermatologists, so whatever. The surgery is something different because we need physical activities. We need physical activities controlled by very strong mentality. That is sometimes quite similar to sports because we need some techniques. So even you have very good sports players, beautiful players, you may think that, oh, this is art. So all these things in my mind that come together to describe surgery. So art, it must be creative. The surgery, sometimes we need some creativity. So we can affect people by emotionally and the impact on their, imagination by doing a surgery. So all this together, maybe we can describe what the surgery is. But this is one of the common questions I got from my medical students or surgical residents. How can I do surgery very well? So my answer is almost always negative. Because when you look at these pictures on your left side and the right side, or both are playing golf, but you notice that who is the better. So, on the right side, he has a perfect swing of golf. He is a Tiger Woods. On the right side, he is amateurs like me. When I ask, it's the same question. When I ask Tiger Woods, how can I play golf like you? If I practice every day, can I play golf like you? The answer will be negative. Maybe Tiger Woods said to me, forget about it and just enjoying. So that's just my question, my answer for the resident. Because Tiger Woods started golf at the age of 3. Even it's very small, his swing improved as he got old, but never been worse. It's always perfect swing at his ages. But in our training system, it's different. We didn't do a surgery at the age of 3. We never imagined. These guys, Lionel Messi, he dribbled a ball, crowds of professional players. He's always better than professional other players. How can I do that? So we have some legend in our colorectal surgery. So Paul Kraske, he developed first rectal cancer surgery from the posterior approach at age of 35. And William Ernest Myers, everybody knows, it's APR, abdominal perineal resection. He developed the APR at his age of 39. You know, the Bill Hill, he developed TME. We always followed his method, his concept of rectal cancer surgery at his age 40s. So why surgery is always difficult to me? Not only to me, to everybody here. Why? We all were too late to learn surgery. Is there anybody to start surgery below 20s? Maybe nobody. And even worse, no one knew whether we are good at or not before you entering the training program. After training program, you notice that if you are lucky, you are good at surgery. If you're not lucky, you always regret, I'm not good at. But it's too late. So our program is different. So only few surgeons in the world can do surgery as Thailand does in golfing. Only few surgeons can do surgery as Lionel Messi does in football. This is our situation. So we have been living in era of expert and masters. Few experts and few masters control the whole world of surgery. We are followers. But things are changing now. Fortunately or unfortunately, I think there are some essential component of surgery. If we think better, if we see better, maybe we can do better. So let me try to the future surgery. How we can do better than our hands. Surgery means something to do by my hands. Probably the answer will be the robotic surgery. That's the reason why we have a session today. But I'm not saying that the robot at currently available. I'm saying that future robot will be smaller and more flexible and more versatile and more precisely moving and quicker than current robotic system. So if you look at the robot is always already everywhere. Car is kind of robot. You have handles, you drive as you want. Even look at the cockpits of airplane. It's more complicated, but it's a robot. And look at the car manufacturing whole process, more than 80% human being is not involved. The robot is controlling the whole car manufacturing system. So in the future, surgery will be the same. Why not? So this is more than 20 years ago, I used first voice-controlled camera handler. It's a robotic camera handler. This is the origin of current robotic system. It's Da Vinci system. Put 4 arms together, it became Da Vinci. It's nothing different from this. The original concept is same. So already 20 years ago, robotic surgery is started, but still it's not enough. We have a 5th generation of Da Vinci, and many other platforms are coming to our market, but it's not enough to have real autonomous robot. Probably we'll have that robot in soon. So the vision is extremely important, especially in the minimally invasive surgery. We have 4Ks, we have 8Ks. Also, still, already we have a 3D with a fluorescence and some other, fluorescence system. So the display and optic system vision is always evolving. The future, in near future, we'll have a hologram. You can see it. Everybody can see it. Same picture in the one space in the middle of the operating theater. So 3D reconstruction is already we use. So this is one example of how we navigate a lateral pelvic nose with the 3D reconstruction with the MRI or CT scan. You can see where the enlarged lymph nodes are located. And during the surgery, we can navigate this system in combination with fluorescence. During the surgery, we can navigate with the 3D reconstruction, and we can identify the lymph nodes by using the fluorescence system. And we found that suspicious lateral pelvic nose and pick up that lateral pelvic nose and to send the pathology examination for the pathology examination. And so even nowadays, we can see the invisibles. We can see the tumor cells. This is a picture of a Nobel Prize winner in chemistry, Dr. Roger Chen, who developed the GFP, this fluorescent protein, to see it, all the molecules, all the colors as we want. This is one example of GFP expressing tumor cells. So you have a microscope, fluorescence microscope, and then you can see the circulating tumor cells during the surgery. You can see the tumor emboli circulating inside of the vein, and sometimes, the tumor cells in the lymphatic channels. So not even to see better, even we can see the invisible one before. So this is one of my colleagues, the project, cancer-specific fluorescence. We can visualize the metastatic lymph nodes compared to non-metastatic lymph node. Non-metastatic lymph node is like a green, as you can see, the ICG. The yellow one is metastatic. You can tell during the surgery which is really metastatic lymph node, which is not. So this is not the fiction. It's not happening in the future. It's happening in this time. So also navigation in surgery is important to localize the tumors during the surgery. So the next thing is more important, how to think better. Maybe we can use the AI. Everybody knows the answer is AI, the artificial intelligence. We have 3 categories of artificial intelligence. AlphaGo or autopilot is already we got it. And probably we'll have, in near future, artificial general intelligence is quite similar to human brain. And if we have a super intelligence, maybe it is like God. So with using the AI is important. Why? And I said in the beginning, the surgery is handwork. But actually, the surgery is not handwork. Surgery is a thinking process. Surgery is a series of a decision and response in every milliseconds. During one hour surgery, you may decide 1,000,000 times. You may respond to some place the million times. And always said to my young generations, surgery is conversation. Surgery is a dialogue between you and tissue. When you touch a tissue always reply to you. Sometimes good way, sometimes bad way. The bad way is perforation or bleeding so you have to listen to what the tissue says during the surgery. So surgery is not hand movement. Surgery is a thinking process to predict what will be happens in 1 second late. If your prediction is precise, correct, your surgery is good. If you cannot predict what will happen 1 second late, your surgery is still, you need some improvement. So all these things, surgery is not only simple movement, physical movement, is a part of thinking process. So that's the reason why we need better thinking. So nowadays we have intraoperative surgeon support using by the AI. This is a part of one of my friends, Masaki Ito's AI system. This AI system beautifully demonstrates the space between the mesorectum and the pelvis. And also artery and nerves clearly can demonstrate during the surgery. So we can have some guidance from AI. So we can use the AI as a guidance. You know, sometimes the AI recommends you track more in this direction and that direction, and then eventually can improve your surgical quality and improve the patient outcomes. So one of futurists already announced that if you like it or not, it doesn't matter, the singularity will come to us. He said by 2045, maybe 21 years left. I'm not sure this will be true or not. Anyways, if we have autonomous robot controlled by AI, maybe we can finish TME within a minute without any adverse event, no bleeding at all. So you think you're laughing, but I'm serious. Probably before 2045, we'll have this robot plus AI. And we'll do the perfect TME. Not me, everybody can do perfect TME. So when surgery started, I don't know when we started, but 100 years ago, so almost all part of surgery is by human being. Now it's changing. It's gradually replaced by machine and instrument and by robot. In near future, the robotic powered by AI will replace considerable amounts of the work in surgery when we have a full autonomous robotic. I'm not sure this is good for you or good for me, but we have been living in era of experts. But in near future, the era of no experts and no masters, but all experts, all masters. This is good or not? I'm not sure. Thank you very much.
Thank you, Professor Chi. It's a very good, excellent presentation as always. And you told us about the history of surgery in minimal invasive surgery at the present and And I sure you give us an eye opening in all participants to look at what is will happen. Yes, thank you, Professor Che.